Okay, my name's Tarun Weeramamthri. I'm Executive Director, Public Health and Clinical Services in the Department of Health, and I'm across basically everything to do with public health statewide, though I don't manage all of the people who are doing public health statewide. But there's a kind of very broad range of responsibilities, everything from disease control and environmental health through to health promotion and disaster preparedness.
Okay.
I was inspired pretty early as a undergraduate medical student. I got a Cancer Council vacation scholarship to work in the holidays and did some work on melanoma and a bit of research, but with some really, really good people, Darcy Holman and Bruce Armstrong. And it was that kind of 6 weeks in the summer just opened my eyes up to some really interesting epidemiology and public health, and realised you could make a difference other than just providing clinical services.
Okay.
Look, it's an incredibly fun thing to do, but you have to take a few risks. You have to have passion in something, but there's anything, almost any passion you have can be turned to a public health career. But the biggest thing I tell people is, if you can, work in the country. And the reason is, I love to see people getting out there, experiencing difficult, often difficult environments with fewer resources, having a go themselves, and you often get chances in the country that you don't get in the city. And when I look at someone's CV for a job in our department, if you've only ever worked in Perth and you've taken really, really safe options, however good academically you are, I'm less inclined to employ you. Okay, so we put a great deal of emphasis on training, whether that's management, leadership, your own professional development. And again, it's got to be sparked by you. No one comes to you and says, this is what you should do. But if you're in a good, interesting job and you've got a good relationship with your manager and you want to increase your skills to do something, you have a discussion about it, and they'll say, well, look, what about this course or that course? Or I really need to know more about this. And we can find things that suit you. So there's no one size fits all. But we actively promote leadership development all the way through, whether that's helping you to make your first presentation about work you've done, or get some more research skills, or whatever it is. We're really excited if you're excited, and we can find a way to do things. People ask me this all the time, and I find it a really difficult question to answer, because I don't think there is one vision. I think we all have different skills, we all have different passions, and if we all find our way of making a difference, it all adds up to improving public health in Western Australia. And the one thing which isn't true is that there's one view about public health. There are as many views as there are people. There's no one philosophy. Some people might, want to work, on a laboratory thing which is about disease diagnosis. Another might want to work with the community. Some people might want to work, in product safety, or in, improving how we use asbestos around the home. It really doesn't matter. You have your passion, and you can turn that passion into improved health. And it doesn't require anyone else to tell you how to do that. You have the idea. Yeah, look, I've in the last few years, I've put a lot of time into it. And we started off, because the world is changing around us, so we can't not reflect that in our work. Sometimes I think Public Health 2012 is more like Expert Health 1990, and you've got to put the public back in public health. And these days that means using social media and having a real conversation with the public. So we introduced Yammer, which is a microblogging tool, into the department a couple of years ago, which we've kind of pioneered, and it's been really, really good in terms of getting discussion going inside the workforce. But we're also increasingly using Twitter, which I'm actively doing now, not with an official Department of Health hat on, but in my own personal time, with some public health messages. I'm also use LinkedIn to get to external people, not inside the department. And I've already had conversations about maybe doing a blog. When you think about it, if you blog and, a few hundred people read what you've got to say, even though it might be a paragraph, that's worth it compared to writing a scientific article, which a handful of people will read. Of course, it's important to do that as well, but maybe some more of our balance needs to be just on more regular kind of conversational communication with people around you. Yeah, look, I think you can. I think you've got to use LinkedIn and to do genuine communication as well. If you just see it as a kind of career thing, then it becomes too calculating, and people can see through that. Sure, link up with people you're interested to link up with professionally, and contribute something. So put your own posts on, spread what you know to other people. If you give through these mediums rather than seek to receive, you'll find that the benefits come, but essentially they're the benefits of good conversation. Amazed how well qualified people are when I meet young graduates, much better qualified than we ever were 20 or 30 years ago, how well motivated people are, and I don't think there's any limit to what people can do in their work and home lives, as long as they're genuine and take feedback. I think that's really, really important. And have great conversations with people where you question each other and you just incrementally work towards making a better place for everyone.
Okay.